Dave Palumbo here with an RX Muscle rant. Today's topic is going to be, what is the association between testosterone and COVID mortality? A lot of people have made jokes about, yeah, Trenbolone, take Trenbolone, it's going to help you get over COVID, it'll help you resist it. You know, there's been a big joke going around. But the truth is that there's new research out that is showing that people with low testosterone have a lower survival rate of COVID-19 infection. Now, there's obviously two possibilities of what's going on here. First possibility, obviously, is that, well, let's discuss first what testosterone does with the immune system. And I think that's an important concept to understand. Testosterone modulates the immune response, meaning that, and I don't know how it really does this, but it somehow, when your immune system reacts to a foreign invader, okay, it has to decide how strong or how weak its response is to this thing. For some reason, this COVID-19 virus causes the immune system to overreact, causing what they call this cytokine storm. Cytokines are basically the artillery that the immune system releases to try to destroy a virus. However, the problem is if it over-releases, if your immune system starts throwing nuclear warheads at this virus, it does collateral damage, meaning it might somewhat destroy the virus, but it's also destroying healthy lung tissue and causing inflammation in the lungs and causing fluid accumulation, which is what's making it hard for people to breathe. So we don't want this cytokine storm. Now, testosterone modulates the immune system, which means that it doesn't make it stronger, it doesn't make it weaker. That's why people think, oh, you take steroids, you're weakening the immune system. No, testosterone actually modulates. It keeps the immune system functioning, not too strong, not too weak. It keeps it working just right, okay? And that's what we want. So when you have lower testosterone, your immune system is not functioning well, okay? And when I say well, I mean that it doesn't know how to temper its response. So people they're finding with low testosterone are not doing as well with COVID infection because their bodies are overreacting to the virus and unleashing hell, basically, on the virus, which is doing, like I said, this collateral damage to the healthy tissues in our body. And we don't want that. Now, the question is the fact that we have low testosterone, or people who have low testosterone exhibiting this, or is the virus itself lowering testosterone? Because there's a theory that it can actually attach to the pituitary gland and stop the pituitary from releasing the signaling hormones, luteinizing hormone, LH, and FSH, follicle stimulating hormone, which actually stimulates natural testosterone production in the body. So if the COVID infection itself is lowering testosterone, which is then not allowing the immune system to function properly or modulate itself, that could be why we're seeing in people who have higher mortality rates, especially in men, that they have lower testosterone. So, it's what came first, the chicken or the egg? I don't know. But the bottom line is that when you have low testosterone, they find that the immune system doesn't function adequately. It overreacts to this virus. And that's not good. So the question remains, if you're on HRT, where you're taking your own testosterone, which is that it's keeping things at a high normal value, will you be more resistant to the virus? Number one, because the testosterone will properly modulate that immune response. And it seems that the answer to that would be yes. Now, we don't know what super high pharmacological doses of testosterone might do in the presence of this virus. I would assume that because it's high, that the immune system would be functioning. But when you start getting into these pharmacological dosages, which are drug-induced dosages, sometimes the immune system can act funky because there's too much around. Anyone who ever experienced what we call serum sickness, or they call it steroid flu. You take too much one shot early on in your cycle, it overwhelms your immune system, and you have this overreactive immune system, and you feel like you have the flu. You take 2 Tylenol, you feel better. But so I think that probably a prudent course of action during this time would be to stay on more moderate dosages of anabolics. HRT seems to be ideal because you're keeping your levels in physiological range, but high physiological range, and it's not enough where it's going to make the immune system go cuckoo for Cocoa Puffs. So that's my take-home message from this. So if you want to stay healthier, and I always believe this, a high normal physiological testosterone is going to keep your immune system functioning well. Obviously, being low physiological is not good. And so if you are exhibiting signs and symptoms, and if you've gone for blood work and gotten low testosterone output, measured, you might consider going on HRT during this, this time period, just to keep your immune system functioning well, especially against COVID-19. You can contact the people at TitanMedicalCenter.com. You tell them RX Muscle Dave Palumbo sent you. They're going to give you a really nice discount. They're going to set you up with blood work. They'll test your testosterone. If it is low, they'll put you on HRT. They'll put you on the right HCG, and they'll put you on the right aromatase inhibitor to keep your levels at good functional levels and keep that immune system healthy. So once again, this research that comes out periodically, and now we're seeing more and more of it because people are studying the statistics, they're studying the levels, they're trying to see patterns of how people are responding to the virus, who's not responding well, who is, what are the hormone levels, what are the different mineral and vitamin, levels in the body. There's definitely now a correlation between low testosterone and poor outcome with COVID-19 infection. So guys, get your testosterone levels checked. I'm Dave Palumbo with an RX Muscle Rant.